The world grows ever smaller. Globalization brings us products from around the world and opens foreign markets to our own. But it also opens our eyes to enduring problems that should be a concern to us all. Nicaragua is the second poorest country in South America, rich in natural resources, but struggling with a severe shortage of doctors and even the most basic water, electricity, and sanitation in its rural villages. In the summer of 2009, a contingent of 11 Northwestern University medical students went to Nicaragua under the auspices of the Global Health Initiative to assist in rural clinics. Their mission was twofold: to bring critical primary care to people who otherwise must travel miles to find a doctor, and to give first and third-year medical students invaluable experience taking patient histories, diagnosing a wide variety of diseases, and working with real people in real conditions.
So what we're doing right now is we got all of our Nicaragua meds sent to us today. What we're doing is reorganizing those meds, putting them in bags so that we can take a specific set of bags every day to clinic.
Largely our focus has been on sorting out things that we can treat from those things that we can't treat. We brought with us some antibiotics, some basic treatments for reflux, some anti-inflammatory medications, things of that nature.
The first village they will visit is Santa Ana, 2 hours away. They can reach it only on a series of ever smaller roads, blacktop to dirt roads, and a rocky climb that forces students to walk while guides push the Land Rovers forward.
Oh my God!
Yeah, they gotta get out of that truck and just push it out of the hole.
When they arrive, they take over a small school outbuilding for the day. Villagers have come from miles around, alerted to the coming of the doctors. They are checked in at an impromptu table and examined in large rooms, sometimes but not always separated by a hung sheet. The students work in teams under the supervision of 2 doctors, Dr. Melissa Brannon, a pediatric specialist at Children's Memorial Hospital, and Dr. Daniel Dunham from the Internal Medicine Department at Northwestern Memorial Hospital.
The model that we set up as medical students is the older medical students work with the younger medical students, so there's an opportunity to do some teaching.
It's the first time you're really seeing real patients and making clinical decisions and trying to get histories and doing physical exams. You really have the freedom to take your time and learn a lot about how to be a doctor on the trip.
They're largely coming to see us with aches and pains, but also there are some things that they've been waiting to see a doctor about for a long time.
One of the first patients in the door is a young child with a distended stomach. Third-year medical student Jason examines him.
First thing we noticed, his belly was sticking out pretty far. After taking a look at his stomach, it was clear that there was either a large worm load in his stomach, but also his GI tract was not working as it should. So we were able to give him some albendazole and instruct the mom on if it were some sort of protein deficiency that he needed to get more protein, and we talked at length about diet, and hopefully I'm almost sure we made an impact on his growth, whether we got rid of the worms or whether we were able to help his nutrition in the future.
Meanwhile, Jack and Dr. Dunham examine a woman whose leg problems have gone untreated for several years.
Me llamo Dr. Dunham.
Been going on for about 8 years. Since our last child was born, burning, itching, painful. Unilateral.
Only on one
just
leg.
up to the knee.
Yeah, so these are just varicose veins.
Correct.
You can do is you can support stacking, and also you can put some topical hydrocortisone.
Vamos a darle una crema para que puede poner para aliviar el picazón y un poquito del dolor. Pero esta crema no va a curar a estas cosas.
Over the course of the day, the students will see over 150 patients. Many require follow-up treatment, but the medical mission is too short to allow for extended care. All the students can do is leave instructions with relatives on the best treatment should the condition recur. The next day, they move on to another village. The team's day begins at 6 in the morning and ends at 7 at night. They could go longer. The line of villagers awaiting care never ends, but their daily rationed medical supplies do. Today, one of the villagers asks the doctors to make a house call to see her mother, who can't make the journey to the clinic. Dr. Dunham, along with a student, obliges.
Buenos días, señor. Me llamo Dr. Dunham.
No me puedo dar vuelta.
Okay.
Aquí
también.
todo me duele.
Y por muchos años.
So you can have swelling in these joints, but this is really extreme. Yeah, see, we don't see disease this bad in the States because it doesn't progress like this without therapy. ¿Tiene dolor?
Sí.
So you can have crepitus, and you can see it's very swollen. One of the best things to do for pain relief is give her a steroid injection. We don't have that, but we can give her the NSAIDs, and that should help give her some relief. There's very little that can be done right now except for pain control, and so we brought some ibuprofen. We're going to have one of the family members come back with us so we can have her load up and give some more to the lady. She obviously is very stoic, but she's in quite a bit of pain, and hopefully we can do something to make her feel better.
Although they can do little more than relieve the woman's arthritic pains, her family shows their gratitude for the help.
It really causes people to sort of look inwardly and to recognize that sometimes the most you can do is to hold somebody's hand, is to have a conversation with them, is to just sit by them at the bedside, and that's not an ineffective way of reaching out or touching people.
And so that human connection is something that doctors can bring to everyone, especially to the people in the most remote areas who never have that opportunity.
These people don't see a doctor on a regular basis. It seems like the last time they saw a doctor was the last time we were here.
They were extremely grateful for us to be there, very welcoming. Every patient we saw was just so excited to see us.
It's going to be life-changing. You're going to find things out about yourself that you didn't know before you went, and you're going to leave inspired to want to do more.
It makes me excited. It makes me really excited to be able to, or to continue my education and to become as knowledgeable as I can be.
To me, one of the key issues behind what's going on here is that right now there's a national shortage of primary care physicians, doctors who go into general internal medicine, family medicine, and general pediatrics are on the decline. There's evidence that students who are on the fence, who are thinking about what they want to do with their careers, an experience like this can be the one that really redirects their career or confirms their decision to want to be a primary care physician.
The Global Health Initiative brings medical attention to people with little access to health care in countries around the world, and provides an invaluable set of experiences that students will take with them throughout their careers.